Hello, good evening. It's Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to today's YouTube live stream discussion. Today, we're actually going to look at a very important aspect of the family. We're going to look at the male side of the divide when it comes to starting your family. So it's possible that your partner is currently battling with low sperm count, or they told him he has low sperm count. Now, it's kind of something that can be very distressful. It can deflate his ego. It can knock off his confidence because naturally, men have this belief that they are invisible. They are, kind of immortal, like they can do anything. And in our society, most things are blamed on women. But we've long discovered that infertility can happen from the man, infertility can happen from the woman. One aspect of infertility in the male is in the sperm. And there are things we can do to help in this situation. Now, is it possible for a man with low sperm count to become a father 100% at any age? When it comes to the whole package of having a baby, of fertility, of starting your family, men have an advantage compared to women. So the sperm is produced every 3 months. So depending on your lifestyle, depending on your health conditions, depending on how you understood your role as a man, if you can flip the odds in your favor, you can improve your sperm quality. Unfortunately, for the women side, your eggs are fixed. You are coming into this world with all the eggs you need to start your family. Unfortunately, there are, if any, things you can do to improve the quality of your eggs. If you live healthy, probably they are going to function properly. Now, when it comes to comparing the chances of having good outcome in fertility for the male and the female, males have, in azoospermia, it simply means you do not have sperm. It looks like the connection is going off and on, but I will continue. In azoospermia, it means when we go for your seminal fluid analysis, we didn't see any sperm. Knowing fully well that per ejaculate, we have millions of sperm. So a man that has azoospermia means when we go for seminal fluid analysis, we couldn't see any sperm. That's the worst case scenario. Now, some men that have azoospermia, depending on the cause of that azoospermia, when they improve their lifestyle, by the time the sperm will be produced in 3 months, they can have a good outcome. But it's not something you do by yourself. You need help. So first of all, this evening, before I start, if they told you you have azoospermia, if they told you you have oligospermia, oligospermia simply means reduced or low sperm count. You need help. You can't do it by yourself. Besides things you can do to modify your lifestyle, you need a urologist. You need a specialist to classify the type of problems you're having. Thankfully, there are certain things we can correct and the man can have help. There are certain things we can correct if it's what we call obstructive oligospermia or obstructive azoospermia. When we correct that particular obstruction, you can have good outcome. But if it's something that is starting from the higher centers are your brain, the pituitary gland, the hypothalamus. So these are the special place where everything about human beings are made in regards to your family. So everything about fertility must be checked. It's not a guesswork. It's not a death sentence. Like what I normally tell people in our organization, regardless of the type of infertility you have, regardless of the duration, regardless of whatever it is, don't stop your PPP. Someone they gave azoospermia diagnosis can have an improvement suddenly and get the woman pregnant. So the fact you have low sperm count doesn't mean you can't get your woman pregnant. Low sperm count means reduced. You still have, but it's reduced. Now, there are 3 parameters we actually look out for in seminal fluid analysis. Low sperm count is one of them. But guess what? It's not even the most important thing. We look at 3 things: the count, the morphology, how good is the sperm, and the motility. Of the 3 parameters, motility is the most important one. So you can have all the millions and beautiful sperm out there. If they can't swim to the tube, you ain't gonna get pregnant. So motility is important. These 3 things, we must check them and understand them properly. Motility, morphology, and count. They are important. Of the 3 of them, if we have fewer cells and they are mobile, there is a way we can help you to still become pregnant. If we have fewer good-looking sperm, a sperm is supposed to have a head, a middle piece, and a tail. There is a way we can maneuver and we can still get you pregnant. Now, across the board, regardless of your age, regardless of the duration of your low sperm count, we always encourage you to do what? To keep on love making 48 hourly. You can still get your woman pregnant naturally, especially if you are on the younger spectrum. There are so many environmental factors affecting your ability to be who you are, exactly the way God made you. It might be your lifestyle, it might be your drinking habit, it might be alcohol, it might be your weight, it might be lack of sleep, it might be stress. They all combine to limit your potentials of becoming a father. So when you have felt bad about it, when you have been deflated, when you've lost your confidence, some men will even have temporal ejaculation problems, temporal low libido, temporal erectile dysfunction. Because everything that happens in sex happens in the mind. So when you come back from the urologist and we told you have azoospermia or you have oligospermia, most men will not even have erection. And an erect penis is the only one that can get with the woman pregnant. So the earlier you understand this, the better. The earlier you seek help, the better. And this is September. The question is, now I have this diagnosis. What am I going to do? What am I going to do with my oligospermia? What am I going to do with my azoospermia? What am I going to do with the fact I don't have a baby? What is the right things to do? This is exactly my interest today. So I'm talking to all the men out there. So many of you have pride issues. So many of you are not even believing that you're the problem. Probably because of a man that felt everything was perfect can suddenly develop problem. The same thing can happen to women. So referencing the past, telling your woman to go and sort yourself, the problem is coming from you, it's not the right way to become a father. Unfortunately, in our society, there are so many mothers that are not good mothers. They connive with their sons to go to the village and start testing women, younger women. They start sleeping with them to see if they can get them pregnant so they can come back and pursue the woman. It doesn't make sense. When you were signing your dotted lines, when you were doing for better, for worse, infertility is the part of the worst. You need to stick together as a team. You need to submit yourself. You go for your seminal fluid analysis. You modify your life. You stop drinking. Some men will take to drinking, and guess what? When you are drinking, you're smoking. When you are smoking, you're messing about. Smoking and drinking can affect your sperm. So imagine yourself having a very small quantity of sperm, which we are contending with. Then on top of that, you're drinking alcohol. On top of that, you're smoking. What are you doing? You are damaging the few ones you have. So if you are so worried, if you are having insomnia, if you are having sleepless night, if you are depressed that you're not a father, exactly like your father, remember your father gave birth to you, and the possibility that your father had so many kids on the front burner, it needs to be a top priority. You need to budget enough resources for this. You need to seek the best help. You need to seek the best urologist in your location. If you're in Lagos, you'll find the best urologist. If you have the resources, you bring out the money and you find what the problem is. When you are looking for a baby, once we have a diagnosis, we have solved that problem by 50%. So it's important you show up and you open up and you accept that you have a problem, and you begin to seek what? Solutions. So what I'm going to do in the next few minutes is to share a couple of things you need to know. Okay? So remember, oligospermia simply means you have fewer than 15 million sperm per milliliter of semen. Remember, what you see at the ejaculation stage is the semen. Sperm is not visible to the eyes. So if you are having low sperm count, we're not just worried about the count. We are more worried about the motility and the morphology. Now, this is a factor in 1 in 3 couples having problems. So think about that. 1 in 3 men having problems becoming pregnant, impregnating your woman, will have low sperm count. Thankfully, most of the problems you're having in regards to low sperm count can be corrected. So getting your sperm count checked is very important. Matter of fact, if you are looking for a baby, your wife is 35 years and above, after 6 months, both of you need to go and check yourself. Sperm count is one of the things you need to do. If your wife is below 35, 12 months, it's a good idea to go together. It's important to understand what exactly is required of you. It's important to understand the next step. One of the tests you must do is the seminal fluid analysis. The seminal fluid analysis, we check the count, we check the morphology, and we check the motility. The most important thing to us is the motility. So we are looking at the quantity and we are looking at the quality. Now, the result will normally come out within 1 week. Now, if we discover you have oligospermia or azoospermia, we don't go with the first result. We go back for a repeat after 3 months. Now, after 3 months, if it's still showing us that you're azoospermia or you have low sperm count, what do? We now refer you to a urologist and a fertility specialist. This is very, very important. So what are the likely things that can lead to low sperm count? Number 1, hormone imbalance. Your body weight can help you to be predisposed to hormone imbalance. When the level of your testosterone is not within the normal range, when you have more female hormones, more estrogen than testosterone, you are prone to be having problems with producing your sperm. Some men can have genetic problems, a syndrome we call Klinefelter syndrome. Some men might have their balls arrested as a baby. Their balls did not descend. It's called undescended testes. The balls originate from the abdomen. Some men might have chlamydia, gonorrhea, or infection of the prostate. Some men might have what we call varicocele. Some men might have had surgery of the testicles or hernia surgery in the past, or some men might simply be overheating their testicles. There are so many men out there that still wear their tight boxers, their tight pants, they sit for the whole day, they drive for long distance. When you do that, you are increasing the temperature of your balls. You are increasing the temperature of the testicles. The testicles do not love high temperatures. Some men consume a lot of alcohol and they smoke Igbo and they use cocaine. You stop that today. Some men go on steroids, anabolic steroids, because they want to be muscular. Unfortunately, some men might be going through cancer treatment with chemotherapy or some antibiotics or some antidepressants. So there are some antidepressants we can give you that can affect your sperm count. And classically, most men have obesity problem. So if you climb the scale and it's telling you that your BMI is above 30, you have a problem. You need to go back to the drawing board. Now, what do we do to get help? Number 1, we will tell you to continue what? Love making 48 hourly. You have to continue your love making. From my experience, many couples will conceive within the 2nd year by just increasing their love making without doing anything. So the first treatment for low sperm count to become a father is what? Increase the frequency of your love making. I am personally giving you a clean bill, a clean check. Make love every 2 to 3 days. But in our group, it's 48 hourly. So if you made love today, skip tomorrow. Begin Wednesday, skip Thursday, begin Friday. Keep on going. Don't stop. Stop your alcohol, my brother. You have had enough. If you are smoking by this time, even if you succeed in being a father, you can die of cancer. You can die of so many other things. You don't need that smoke. Stop it. Stop deceiving yourself that, oh, I'm addicted and all those stuff. Stop those nonsense. Start exercising. Eat your balanced diet. Eat your fruits and vegetables. Now, some men might require what we call gonadotropin medicines. So we can give you some medicines to help us in producing sperm, but we have to have a clear diagnosis. If we can't find the right reason why you're having this, then we're not going to give you this drug. We can only give you this drug if we discover that the hormones that will help you to produce your sperm are not working. We don't just go about giving people this because it can lead to a lot of problems. Now, you can also go for IUI. Matter of fact, IUI is specifically meant for men that have fertility issues. IUI stands for intrauterine insemination or artificial insemination. So what do? We take over the function of the penis. We collect your sperm, we wash your sperm, we concentrate your sperm, we make sure it's good quality, then we drop it directly inside the womb. Once the sperm gets to the womb, the sperm will begin to find its way to the tubes where the ovaries would have released the egg. So the criteria for going for IUI is to make sure that the woman is ovulating. Some women might not be ovulating. We might need to give them Clomid or other ovulation induction drugs. But IUI is a very, very good method you can use to improve your chance of becoming a father. Now, IVF is the ultimate. If you have the resources, and if age is no longer on your side, and if age is no longer on the side of your woman. So what do I mean? If you guys are 35 years and above, the age of your woman, the man can still be a father at 90. If your woman is above 35, consider IVF immediately. Don't waste time. IVF is the top echelon when it comes to infertility management. So if you have the resources, IVF might be your best chance. If your sperm count is slightly low, or if you have a problem we've identified and your wife doesn't have that ovarian reserve waiting for her, go for IVF immediately. IVF works. It might not work the first cycle, subsequent cycle might work. Now, when you're going for IVF, it's also advisable to consider a special type of IVF. We call it ITSCI, intracytoplasmic sperm injection. So instead of just dropping the sperm right there to see what will happen, we collect the sperm, we inject the sperm directly into a plasmic sperm injection. Is a specified, customized type of IVF. Most men that have very, very poor quality sperm would need this, because what we're going to do is to break down from millions of sperm. We begin to look for the good ones, then we isolate them, we concentrate them, then we inject directly. Very, very important. Not everybody might be qualified for this, but please, if you have the resources, it's a little bit expensive, but if you have the resources, this can help you. Very, very important. Now, I'm coming to the tough part. I know we are Nigerians, right? I know so many men might not like this particular method. Sorry, guys, talking is a form of exercise. You can always tell yourself the truth. So my brother, listen to me carefully. If you have done all this, you've tried lovemaking, you've done it diligently, you've lost weight, you've stopped drinking, you've stopped smoking, we've treated you with gonadotropins, we've gone for IUI, we've gone for IVF, it's possible that the problem needs to be upgraded. What do? You go for donor sperm. Go for donor sperm. Your boss is not going to disappear. You will not stop being a man. You will only become a father. So kill your pride. Forget your culture. Forget your religion. Go for donor sperm. Do you know why? The only other option left for you is not to be a father. The opposite of being a mother is what? Not a mother. The opposite of being a father is what? Not a father. So if your sperm is very bad and you don't even have sperm, my brother, what are you going to do? You quietly and wisely go for donor sperm. Guess who will know you had donor sperm? Only your wife and your doctor. And if the doctor is professionally trained, no doctor can leak your secret. Your secret stays secret. Matter of fact, let me break this ice. Do you know that between you and your woman can keep her secret? You can keep your secret between the two of you. If you are in the clinic and she wants to tell us something and she doesn't feel comfortable with you, we can excuse you and we can extract the information from her. Her secret is her secret. So in the same vein, your secret is your secret. But if you're coming to the table of becoming a father, he that comes to justice must have a clean hand. We deal with your past, we deal with the present, then we project to the future. Our aim is to be a father. Now, thankfully, Women that are a little bit older have a better advantage of having multiple pregnancies. I personally have seen a couple. The guy is 56. Very bad sperm indices, erectile dysfunction, premature ejaculation. Every problem you can have in this world, this guy got it. Guess what happened? The wife, when God remembers you, when God opens your chapter, right? Are you listening to me carefully? When God opens your chapter, God is not going to give you double. God will triple, quadruple your blessing. But you have to be in the arena of blessing. What did I do for this lady? I referred her to one of my providers in Lagos then. For some reason, she wasn't comfortable going to the Lagos. Matter of fact, the guy didn't even feel comfortable going for any treatment because most men believe that the woman is the problem. It's the women that will always say, let's go, let's go. And the men will say, go and sort yourself out. I don't have a problem. We are believing in God. I referred them to Lagos first. They went there for some reasons. Lagos didn't work. I now came back and I referred them to Abuja. The man reluctantly went to Abuja. He's 56, completely done, with so many bad indices, with so many comorbidities. But guess what? Mercy said no. They had 4 babies. They were the second set of quadruplets I was able to achieve with my provider in Abuja. As I'm talking to you guys right now, guess what? This lady is now flexing. She's now a mother of 4 babies, 2 girls and 2 boys. From nowhere, just by connection. So my brother, let me tell you the truth. When you are done with your own understanding, which is nothing to God, lean on God. Your biggest prayer, if you want to be a father next year, is to tell God, God, please, I have come to you with my little wisdom, with my little understanding. God, please connect me to the right doctor. People take off from America here to go to Nigeria to become pregnant. And they still come back. People do so many things. People do adoption. People do surrogacy. People do donor egg, donor sperm. There are so many options. You don't need to go and put your news in CNN or NTA. You don't need to do that. You don't even need to tell your mother. You don't need to tell your brother. You don't need to tell anybody. What you do is between the two of you. And you will be a father like any other father. The opposite of not doing this is not to be a father. The opposite of not, and it affects women more. Do you know why? Because you enter menopause. When you enter menopause, my sister, that's the end of the journey. And of course, religious people will come and confuse you. Don't worry, I don't believe in this. This is that. That is that. Before you know it, you have entered retirement. My people, retirement is not a bad thing. Menopause is retirement. It's a good thing. Every woman will retire, but how do you retire? Consider yourself at age 70. Who will be there supporting you? I know what I go through if I hear that anything is happening to my mom. I freak out. And my mother-in-law, I freak out. I'm practically living for them. Nobody wants to see their parents suffer. When you are old, the table flips. We begin to look after them. How will you look at age 80? How will you look at age 90? Who will call you a mother? Who will call you a father? Will you go back to that church? Possibility that particular pastor that confused you might have died. He might have made a lot of money. They might have, sent him elsewhere. All your uncles and all your aunties in the villages telling you no. All your friends telling you no. They might have completed going for their omugo. And you will be the only person facing the wall in the night. And nobody is calling you a mother. Nobody is calling you a father. What are you going to do about it? What are you going to do? When your back is back to the wall, what are you going to do, my brother? Kill your pride. Rise today. Change your story. Don't allow your family name extinguish during your own tenure. You have to continue. You have to take this as your project. Today is the 13th of September, 2021. If you are committed, if you want to go, we can go with you. We can set you up. And by this time, by the special grace of God, who made every good thing, by this time next year, you will be a father. Possibility you'll be a father of twins. Possibility you'll be a father of triplet. Possibility you'll be a father of quadruplet. Look, I have seen God blow my mind away. I have seen God bless a lady with 1 tube with 4 babies. I have seen things that are marveling. So if you think I just show up because I love, no, it's a passion. So I'm telling you today that even with your low sperm count, even with your poor motility, you can be a father. Okay, so thank you so much. I'm sorry I veered off a little bit, but right now I'm going to take care of questions. So please go ahead and ask your questions. Please feel free to ask your questions. Don't be shy. If you need to talk to me in the private, why not? Then you have to follow due process. I know we look for comfort in football, in sports, in this, in that, but it's time to take action, my brother. So please, the floor is open for questions. Please go ahead and ask your questions. I'll provide you feedback. Okay. Ebenezer, I excused you. You were not feeling too good. I'm happy that you were able to bounce back. Okay. Are there genetic or age issues that hurt male fertility? Correct. Now, remember when I was talking about the likely causes of low sperm count, I mentioned what we call Klinefelter syndrome. So it's a genetic condition you can pick up from birth. Now, besides the genetic condition and chromosomal problem, majority of the things that affect us are the things in our environment. What you put in your body, what you don't eat, what you expose yourself to, the people you hang around with, the things you allow to bother you. Some men do not sleep. Sleep alone can kill your libido. Sleep alone can affect your sperm count. You're pursuing money up and down. You don't sleep. You're up in the night. Money you don't have. Baby you don't have. At the end of the day, you develop hypertension. You add a lot of body weight. You develop diabetes. You on top of that, you have cholesterol problems. And it's possible it runs in your family. Baby you don't have. Money you don't have. You become depressed. And if you're in Nigeria, you begin to see yourself as a second citizen. So yes, environmental factors can cause this. Genetic factors, like if you have Klinefelter syndrome, I'm not going to go into the details. If you have Klinefelter syndrome, it means your ability to be a man is compromised. Okay? And there is nothing anybody can do about it. Okay? Does family history matter? Yes. There are certain genetic predispositions. You see, like in my family, I look more like my mom. Matter of fact, if you know our family, my mom's younger brother can pass for my father. We look so much alike. He just happens to be a little bit fair, but I took after him like 100% from my mom's side. Okay? Now, that's maternally determined phenotype. Phenotype is what you see physically. Genotype is what is encrypted in your gene. Now, from my father's side, guess what I picked up? I picked up some familial predisposition to hypertension, to diabetes, and obesity. So sometimes you pick the good things, you pick the bad things, you mix them up. So if you pick some genetic predisposition from your father, from your mother, it's going to manifest. Now, thankfully, when we modify our lifestyle, there are so many genetic things we can flip. Like if you have predisposition for hypertension, for diabetes, for cholesterol, when you modify your lifestyle, when you know that you need to work on your BMI, when you work on your BMI, you can flip the script on hypertension. You can flip the script on diabetes. And when you're doing this, you are improving your chance of becoming a father. Because guess what? You know, when I tell you guys to make love every 48 hours, some men will be complaining. Doc, I can't even survive up to one round. And you're telling me, do you want me to die? This lady is going to kill me. And seriously, you don't blame them because you need energy to make love. And if your body weight is in the 30, you cannot perform now. You'll be snoring like a Christmas goat. That's a fact. So the totality of you needs an overhaul. If you really want to be a father, being a father is a serious business. So there are so many billionaires today. They have used their money to go all over the place. But lo and behold, my brother, you don't have sperm. Now, let me surprise you. Do you know that some of your friends telling you not to do this, not to do that? You don't even know how they had their baby. You did not put touch when they were doing their own thing. There are so many of your friends that went for IVF, IUI, adoption, surrogacy. You don't even know. Whatever they feed you, you tell. If they give you invitation for baby shower, you show up. What do you know? You don't know. But people are easily carried away. Second parties, third party, every time they can Harry will be giving you advice. Oh, don't do this. IVF, like one of the questions I got today, that babies that people had through IVF will live up to 20 years. Who's telling you that BS? IVF has been around for 4 decades. Change your knowledge base. Change your attitude. Change your infertility story. Refuse to buy into the silliness out there. Are there occupations that increase the risk of male fertility? Yes. Anything that keeps you sitting for long. Sitting is the new smoking. Sitting is going to kill you. Do you know why? When you sit, you are increasing the temperature in your groin. When you are increasing the temperature in your groin, you are not creating an enabling environment for spermatogenesis. Spermatogenesis is the process of making sperm. Sperm is made better in a relatively cooler environment. The reason why the testicles and the scrotum is hanging out outside the body is because that's the right temperature to make sperm. So when you sit in one place, let me give you an example. You slept on your bed, you were snoring the whole night. You managed to wake up, you took yourself to the shower, you came down, you sat on the couch, you ate your vegetables or whatever, you ate your breakfast, then you managed to drag yourself to the car. Then you entered the elevator. Then you went to the office, you sat in the same chair from morning till night. Before you go, you enter the same car, you come back, you're using remote control, you're sitting in one place. Guess what you have done? You have killed yourself without knowing. Men that are a long distance driver. So if you drive a long distance, is also a risk factor. So anything that will increase the temperature of your groin, avoid that. Definitely avoid wearing tight fit. Look, what are you doing? Wear your breathable boxers so that the air can go, in and out. The more you have air going in and out, the more you're increasing your chance of having good fertility. Okay? Okay, guys, let's see. Do we have any other question? If we don't, we wrap up. But this is an important topic. It's possible that your partner might not attend. Some people want to do things in the secret. I understand that. I'm going to make my transcript available, and I'm also going to make this video available. What you need to do, go and subscribe. When you are done subscribing, share it with him. So many men are so too full of themselves. It can be a good thing, but it can also be a negative thing, because a good leader, a good man should be in the front. If your family, if an armed robber comes to your family, if they are trying to kill the whole family, who will step up to defend the family? The man. Now, infertility is trying to steal the joy in your family, and you're just playing hard and sick, and you're calling yourself a man. A real man will go and do everything possible to become a father, will employ all the resources. If God gave you the money, go for the best. Become a father in 2022. Shame the naysayers. There are so many people that are writing you off. So many of your friends are now gossiping about you. You know yourselves. It's no longer the people you used to hang around that are hanging around you, because they have started having their family. Some of them might have made money. They have removed you from the equation because you don't have a baby. If you're having normal misunderstanding with people, they use the fact you don't have a baby to attack you. And it kills you every day. Now, what is your plan? What are you going to do? God can quadruple your blessing. God can triple your blessing. Look, you don't even know the type of God we're talking about. If you know, you wouldn't even bother. Okay, so thank you for coming. Do we have any other question? If we don't, I'm going to take my leave. Ebenezer, since you're in attendance, can you share the topic for tomorrow before we go? Please share the topic for tomorrow. Okay, can I thank you for coming? I know it's been a very busy day for everybody. I was just coming back and I needed to talk about this because, most times we talk about the women, but we don't necessarily talk about the men. It's about time we start talking about everybody's case, okay? So Ebenezer, share the topic. Let's see if we can wrap up at the 35th minute. But if you still have any question, you can still feel free and ask. Make sure you subscribe. Make sure you click like. Make sure you tell people about this channel. It's completely free of charge. But it's a channel that if you are dedicated to SGHS, believe me, if you are dedicated, if you practice your prayer, you're playing 48 hourly, you're practicing, you have a urologist, you have a fertility specialist, you will stop drinking, you will stop smoking, you will start. My people, exercise doesn't mean you have to go and be jumping up and down. 30 minutes. 30 minutes. You can go for walk for 30 minutes. Come on now. 30 minutes. Then watch what you eat now. And you're not going to finish the whole beer in the community. Tomorrow, how to increase your libido. Look at that. So if you notice, most of our topics are kind of interconnected. So tomorrow we're going to talk about libido. Libido means your sexual desire, because we're going to talk about the second pill. You cannot become pregnant in a vacuum. You must make love. So tomorrow we're going to talk about that. So thank you for coming. I appreciate you guys. Kenneth, thank you. Ebenezer, take good care of you. I'll see you guys tomorrow. Thank you for coming. Bye-bye for now.